He's back.
Hello,
Thank you,
everybody.
Justin.
My name is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management here in St. Clair County. And as always,
Oh, yep. And I'm Dr. Annette Mercatante from the Health Department. Welcome back, Justin. We decided it'd be
well,
good to
thanks.
have a little support here, and we'll try to answer all your questions. Let's get right to the data and get through this week's changes. So we have over 20,000 total cases, over 800 hospitalized, 457 deaths. And in the last week, we've had 9 reported COVID deaths with an average of about 50 new cases per day. Our testing positivity rate remains at 10%. Next slide shows this interesting epi curve, which shows kind of a gradual increase with what might be a plateau, it might be an increase. It's not clear statewide. We're still seeing slight increases throughout the state, but I would say definitely a little bit of a slowing. Would you say slowing of some cases? So that's all good news. The bad news is that generally after a few weeks of elevated cases, we see elevated hospitalizations and elevated deaths. So watching those rates come in is always the most traumatic for us because, it's not just about the virus spreading, it's about the impact that it has on human beings. So next slide. And our vaccination rates continue a slow uptake. So there is about 300 to 400 new vaccines distributed or provided every week in St. Clair County. So people are still slowly coming forward and getting their vaccinations. That's great news. I'm sure we'll talk a little bit about the COVID booster as well as the anticipated use of the Pfizer vaccine in the 5 to 12-year-olds. That's not ready yet, but everyone's going to talk about it. And our data dashboard, as usual, you can get a number of questions asked. And actually, I just want to remind everybody, since we get a lot of the same questions about, hey, how do you do this? And why do you do that? Why are you doing it this way? We have tried to take those questions and put them into an FAQ. And so if you have concerns about why we do data a certain way or why we're interpreting something a certain way, hey, isn't this just the flu? All of those questions that we get over and over again, that you would probably find them in our FAQ. And if they're not there this week, they'll be there every week. We're adding to that list. So please go there. And I think you can find a lot of stuff about masks, a lot of the things that people kind of keep asking about. So all right, let's get to your questions. Or my comments, right? I got to start with my talking point. So the big issue today, and the big issue probably for a little while, is the state budget approval. As you guys know, or maybe have heard, Governor Whitmer signed the state budget. There was language in there that was inserted, I would say, kind of surprisingly at the end of the process. Certainly surprised all of us, but it does threaten public health funding for any health department that has emergency order issued as of October 1. So we are, before you guys ask us what we're going to do, all I can tell you is that we are in the midst of consulting with our legal counsel and with each other and with our colleagues on how to proceed with our local order, which, as you know, we only have one local order, and that's the quarantine order. We do not have a mask order. So it's ongoing. It's fluid. I'm not going to announce at this Facebook Live episode what our decision is going to be. It's a challenging decision, and I think one that all of us have a lot of trepidation about. So we'll just say watch our website, watch our Facebook page, and we'll get that information out as soon as it's finalized. Okay.
Thank you. Justin, would you do your talking point?
Yeah, so the big one for me is the CDC. There's been some confusion over COVID-19 booster shots, and the CDC is finally recommending COVID boosters for select individuals who received 2 doses of the Pfizer vaccine after the 6-month period of their second dose. So those individuals include older adults, 65 and older, adults in long-term care or other institutional settings, people aged 18 to 64 with certain underlying conditions, adults working in certain jobs where they're at an increased risk of exposure to COVID-19, such as first responders, healthcare workers, firefighters, police, congregate care staff, teachers, support staff, and day workers at our schools, as well as food and agriculture workers, manufacturing workers, correction workers, U.S. Postal Service workers, public transit, grocery store workers, and there could be additional add-ons to that list as the CDC continues to provide guidance. The other thing that I'd like to remind everybody is this only applies to Pfizer vaccine right now. There is no booster for Moderna. There is no booster for Johnson & Johnson. So just remember that. If you're Pfizer, you're good. And if you fall into those groups, and if not, you just have to stand by a little bit while they continue to work on that. And I also want to remind everybody to get the flu vaccine because we know that stopping the flu can potentially stop other ongoing communicable diseases. So it all helps, right? So there you go.
All right. Thanks, Justin.
One more. The flu is just one more burden on our
Right.
system that we don't need at this time, quite honestly. Yeah.
All right.
Okay.
So I'll go over the first question. We only had one question that came in last night, and it was, what are your current recommendations for churches, like masking, singing, receiving communion, social distancing, shaking hands?
Same recommendations we've had for everyone indoors. So as these rates increase, your risk of transmission indoors increases. So people indoors, vaccinated or unvaccinated, should be wearing masks, right? In particular in settings where there's singing and, kind of expelling things. So I would highly recommend masking in a church situation or any social situation where you're indoor in this congregate setting. Don't forget also other things like proper ventilation, frequent hand washing, disinfecting high touch objects and areas, and most importantly is to not visit congregate or indoor settings when you're feeling ill. When you're feeling ill, get a test. If you're COVID positive, stay away from everybody for 10 full days. And if you are an exposure to a COVID positive patient, to quarantine yourself for a minimum of either 10 days without a test or 7 days with a test. Excuse me, did I say that right? 10 days without a test or 7 days with a test. With 14 days still being the ideal duration of a quarantine. So regardless of the situation, isolation and quarantine components are extremely important for people to continue to follow, regardless of the environment you're in, right? Whether it's in your home, your workplace, your church, card parties that you go to on a regular basis. It's really just about, do you really want to be responsible for sharing a virus with someone else that could potentially land them in the hospital or worse?
Yeah,
All
and
right,
if you don't
thanks.
mind, Jen,
Yeah.
if you don't mind, I just want to reiterate to everybody. Obviously, there aren't laws for these things. These are best practices to work as hard as you can to ensure you don't get sick. That's all we're trying to talk about here. And that's why Dr. Mercatante and her staff constantly give the guidance, is because as we've gone through this 2+ years, it's the best known advice to have the best probable outcome.
All right, thanks, Justin. Okay, we're moving over to the live questions now. The first one is from Chantel. She said, why do vaccinated people not have to quarantine if they are still able to pass the virus? So this might be a good opportunity, Doc, to talk about the vaccinated versus on and what we talked about
Well,
earlier.
yeah, we'll talk about that. But again, I want to refer people back to our FAQ. This is a question that's asked every week. I think people confuse the idea that the difference between if you're vaccinated and still get sick, you have the same isolation requirements as if you're unvaccinated and get sick. So regardless, vaccinated or unvaccinated or previously infected, if you get sick, we still expect you to get tested. And if you have a COVID or you believe you have COVID and don't get tested, but if there's a COVID component, you need to isolate for the full 10 days. Okay. Remember that COVID tests, if anything, are falsely negative. You can still have COVID and have a negative test, which is much more likely than having a false positive test. So if you get a positive test, you can be pretty sure you have COVID. If you have a negative test and you have all the symptoms of COVID and just were exposed to somebody who had known COVID, I would still be very careful about assuming you don't have COVID. You might want to consider retesting. Okay. So anybody with COVID, anyone ill, vaccinated or unvaccinated, you should isolate. Okay. 10 days. People who are vaccinated or people who have recently had a COVID infection, and the CDC is still saying 90 days, and that duration can change. Perhaps we know that in some people the immunity can last even longer than that, but it's really spotty. There's data that suggests it's not consistent, which is why we don't have a broader label. But people who've had previous infection, people who are vaccinated, are really unlikely to get COVID again. It's not impossible. It happens. We have people in the hospital. We've even had people who've died with vaccination, but it's way, way, way less likely. Okay, I think that the data is still 1% of vaccinated individuals actually get COVID. Okay, so it's unlikely. So that's why we say that those two groups of people, if there's if there's an exposure, we're not going to quarantine. We're going to advise them to be very careful with their own goings about, for them to protect other people from them inadvertently if they did get infected, by wearing a mask and asking them to get tested after a few days just to be on the safe side. So that is just basic CDC guidance based on relative risk, relative risk of them actually getting infected. Those who are unvaccinated are still highly vulnerable after an exposure, and that's why our advice to them is to fully vaccinate, avoid other people for the minimum of 7 days so that their risk of infecting other people goes down as well.
All right. The next question is from Penny. She said, I had a message from Kayla saying she was representing SCCHD and doing a Morgan research. She wanted me to call 1-800-98-0035 for feedback. Was this legit? My caller ID said it was from Tennessee. So it's actually Wilkins research. It's for the behavioral risk factor survey. So Doc, do you want to talk about that?
Okay. Sure. So every several years, the St. Clair County Health Department engages in a very comprehensive review of our health situation, which partly includes a very comprehensive phone survey of people who live here, asking them questions about their health issues. And this is anonymous and confidential, but we are out in the field now collecting that data. We hire a research firm to do this because there's a process involved. You have to do it in a very specific way to make it legitimate. And yes, they are a firm out of Tennessee called Wilkins Research, and they are in fact legitimate.
And they are leaving messages this time around. So that is accurate.
Okay.
Bonnie had a comment. A huge thank you to the health department employees for keeping the community safe. You are appreciated by many. Thank you, Bonnie.
Thanks, Bonnie.
Okay. The next is from Cindy. What is the recommendations for teachers that are not vaccinating and not masking? Should he or she quarantine with the students once a student in his or her classroom tests positive for COVID?
Yeah, of course, our recommendation is for everyone to mask in our schools, vaccinated or unvaccinated. And we highly encourage everyone to get vaccinated who's eligible. Failure to do that, your exposure is based on the distance from the individual who has the case and the duration of time that uh, that that you were there. So if you're within 6 feet of an individual for up to 15 minutes or more, we consider that a high enough risk of exposure to recommend quarantine. And so that would be the parameters. So if you have a teacher that's way at the front of the room and there's environmental engineered components, things that prevent that, that teacher's not going near their students, then these are things that the school makes calls on, right? We can't possibly be in every situation and every room. And so they know the situation with a positive case. They evaluate these classrooms for us and then send us the list of people they feel could be exposed. Sometimes people say, no, that's not right. I don't think, and we reevaluate that situation and we talk to them and make those individual determinations. So it's not an automatic thing just because you're in the same room as an individual. It's really based on that proximity and duration of time.
All right. Next question is from Penny. How long after getting COVID booster will it have full effect?
14 days, right?
Yeah, typically we say
Ish.
2 weeks.
14.
Most vaccines are a full 4 weeks, maybe 6 weeks to be fully effective. But since this is a booster, I would say the impact would probably be expected a little quicker than 14 days. Don't forget, I'll just say this, despite all the conversation about COVID boosters, I just want to remind people that there is no evidence in this country, I would say probably in the world right now, that um, the efficacy of the current vaccines is going away. Our current vaccines are still providing the same level of protection, especially protection against being hospitalized and dying, as they were a few months ago. The recommendation for boosters, some of the studies that show serology changing, etc. But all of you who've had a full course of vaccine, whether it be Moderna or a 1 dose of J&J, you still have a significant amount of protection. There's nothing clinically that we've found where suddenly people are getting sicker again, despite having vaccinations. It's been pretty stable. So I think that's really good news, and I want people to be reassured by that.
All right, the next question is from Janine. She said, can you please clarify the quarantine rules for homes with a family member who is COVID positive? Example, family of 4, one person COVID positive, not isolating.
Well, household exposures are our highest risk exposures. We can honestly say that most people who transmit the virus one to the other are living in a congregate setting or living in a household, right? Again, this virus doesn't jump over walls. It really requires people breathing on each other. 15 minutes is a criteria, but obviously the longer you breathe on each other, the greater the chance that enough virus is going to be spread that it will infect another person. So household contacts are one of our highest risk. Anyone in a household who has positive COVID, whether either sick and they tested positive, or maybe they're asymptomatic and they tested positive, and the test is reliable, it's a PCR test, then we do have the situation where everyone in that family should be quarantined. Okay. Now, the quarantine in a family situation is a little tricky because your quarantine begins on the last day a person could still be excreting the virus. And we've already explained that this isolation period from the time you get sick to the time we feel you can safely not be spreading the virus is 10 days. 10 days. There's no test out option. It's 10 days. So a family's quarantine, if they're all continuing to live together, and I can talk about that a little bit, really starts on day 10 of the case, right, of the person who's infected. And then everybody quarantines for 14 days, 10 days, or 7 days with the test out. So that's the process, and that's what confuses people because your quarantine period starts at the last exposure date. And the last exposure date for a case is their last day of isolation. If that helps, I'm not sure I'm answering the question from what you want, but that's really where we get the most confusion. And of course, if someone in the family that's exposed starts getting sick and they get tested and they're positive, then it all starts all over again. I just want to say we have had families that have moved their living situations around as a result. They go in the basement and they say that they're really not having any exposure. There is a point where we have to take people's word for that. And there are situations like that where we can shorten that quarantine period and begin it a little sooner than at the end of a case's isolation date.
All right, Christina asks, so are students going to have to wear masks in the classroom now?
Well, God, if we didn't if we didn't do a mask mandate 2-3 weeks ago when cases were starting to crank up, we're obviously going to take a pause right now until the legislature and the legal teams get their act together a little bit. I mean, really, this is, if it were up to us, we would have everybody wearing masks in school. There's no question we know. And I can tell you that we have a really interesting experiment going on in Michigan and throughout the country where we have schools that are masking and we have schools that aren't masking. And we've had about a month or two of that now. So we can actually look at cases in one versus the other. And the data is really compelling. It's very compelling. Schools that mask have less cases. Duh. I mean, it's not rocket science, but we are starting to have more and more epidemiological proof of this. And so, in my mind, when you've got a virus that spreads this easy and can potentially kill people, putting a mask on is an extremely reasonable thing to do. So, we think it's a good idea. We want to encourage people to do it. We want to encourage schools to require it because schools are legally allowed to do this even now. And as a health department, we're going to wait our turn and see what transpires over the next week or so with the legal conversations.
All right, the next two questions have to do with Port Huron Northern. So the first one is, are you aware of the numerous cases? This is from Janine. How many warrants a 2-week pause?
Okay, yes, we're aware of the cases. Sometimes people in the field, like you all, might be aware of even more cases than we are. Remember, we are only aware of the cases that are officially tested and reported into our system. But we do know what's going on out there. When to take a pause? Well, honestly, that's generally the school's call. If they can function as a unit, they have enough teachers, they have enough students that can attend, they like to continue. But also, if things are really starting to get kind of out of hand, they'll often take that pause with our support. I have not had to step in yet at all for any of our schools to uh, force them to do this, right? They almost all on their own recognize when they're in trouble and when they're really not able to conduct in-person learning in a reasonably safe way, and we make those decisions together. So that's what we kind of do. We watch, we wait, and then if there was a situation where a school refused to pause and we felt it was really important, we might step in then. But I just don't see that happening with the school leadership that we have right now. They're all very, very good about this.
So Nikki also had a question about Port Huron Northern and your recommendation for them. 60 students and 5 staff in 2.5 weeks. Do we know how many of them are vaccinated, hospitalized, or seriously ill? Thank you for always informing us the best you can.
Now, off the top of my head, Nikki, I can't really tell you the exact breakdown. I can almost guarantee you that the majority of students that, if they're ill, are not vaccinated, but there's probably some vaccinated individuals in there. Um, Hospitalized, seriously ill, that's a different question. Again, we find out that often late in the game. I can tell you we do know of people who are seriously ill and hospitalized, including some young people. So, unfortunately, remember, hospitalizations and serious illness, this virus is insidious. So it starts out pretty mild, even in people who end up getting really sick. First week, they don't feel too bad. And then gradually, their airways get filled up with fluid and they have harder time breathing. And it's kind of a prolonged post-inflammatory situation with this virus. It's not the initial viral infection that seems to do people so much harm. It's kind of a unique and post-viral progression that occurs. And why it occurs in some people and not others, I don't know. But it is a very delayed response, many times, not always, but it's a delayed response, which means that I'm a little concerned we're going to be seeing some of those more serious things in the next coming weeks.
All right, this is a data question from Jonathan. He says the CDC survivor rate if you get COVID, age group 0 to 19, 99.997%, 20 to 49, 99.98%, 50 to 69, 99.5%, 70 plus 94.6%. Are these not accurate?
I would assume CDC's data. Do you want to answer that question? Okay. So we have a 1.6% case fatality rate. That means out of everybody we know of that has COVID, 1.6% of them died. It was 2%, so that's good, nice. 2% locally. We know that case fatality rate changes with age. We know that a lot of factors impact death, including geographical area, underlying health conditions, uh, hospitalization, healthcare situation. So I'm not disputing CDC numbers. I'm just saying that locally and throughout the state, we have significant impact from this virus. Death, by the way, is the least of our worries. This virus, as I just mentioned, causes a significant prolonged hypoxic. We've all heard of long COVID. It's connected now with long-term neurological disorders, blood clots, myocarditis, and not to mention the cost of being hospitalized for a week or two, assuming that you're going to survive, is pretty profound. I think minimum of $50,000 is what we're seeing as an average cost of a hospitalization. So there's economic impacts. There's lost wages, and not to mention the pain and suffering of a prolonged illness. So I think quoting numbers like that is a little disingenuous. I think it's trying to say, look, what's the big deal? And I'm just saying you have to look a little bit beyond this kind of 99.9 in a 0 to 18-year-old age range, because that's really a very small part of the story.
Yeah, and that's a potential for 280,000 plus kids dying. Like, that's just the 0 to 19 number. Those numbers, when you add it to 780 million people in the United States, give or take a couple million, that's a lot of people that have the potential to pass away. That is unnecessary if we do some small things to kind of help stop the transmission.
All right. This is from Kevin. What about someone that had GBS? I'm not sure what that is.
Guillain-Barré syndrome, and it's a post-virus, very well identified post-viral neurological symptom. It happens most commonly after a viral infection, sometimes a very benign viral infection, where you have a progressive neurological deficit. It's generally self-limiting. People's neurological can come back, but sometimes it gets so bad where a person can't breathe on their own and has to be ventilated for a while till things get better. So it's rare, but well documented, and it is associated with all viral conditions. Although I have to say, I don't believe GBS associated with COVID has been a particularly red flag. In other words, it doesn't appear to be happening in post-COVID patients more than in the general population. And I can tell you that also GBS and COVID vaccines do not seem to be particularly impacted as well. In other words, post-vaccine, if you get a COVID vaccine, you have the same risk of getting Guillain-Barré syndrome as if you didn't get vaccinated. So we're still keeping our eye on that. It's rare, but again, that doesn't seem to be, in this particular situation with COVID, coronavirus, the big thing to worry about. Now, influenza, well documented its association with influenza. Okay, so another reason why people say, isn't this just the flu? It's like, no, it's not. This isn't the flu. It doesn't act like the flu. It doesn't affect us the way the flu does.
All right. Chantel, who asked the earlier question, needed some more clarification. She said, I guess my concern is if a vaccinated teacher has an unvaccinated child at home that's COVID positive, can she not still pass it to other children? Is it safe for them to continue to teach regardless of vaccine status?
No. Oh, I see. So the teacher's vaccinated and the child's at home. And because she's vaccinated, we don't impose that quarantine on her. That teacher should be wearing a mask and she should be tested. Okay. Because there's that small risk that she still might get infected and she may have an infection that is undetected or mild, especially in a situation where she's in a classroom where potential is there. Those are absolutely situations that, despite the fact she doesn't have to be quarantined, there should be a couple extra layers of protection in it. So she should be wearing a mask for the full 14 days of her quarantine period, which, by the way, again, would be the beginning of her quarantine period, would be the last day of her child's isolation period. And I would strongly recommend a couple of tests in there on days 3 and on day 5, with the area where she'd have the highest risk of having a higher viral load, especially if she was not having symptoms. And of course, at any point she became symptomatic, she should not report to school, and she just stay home and get tested till she's confident that she doesn't have COVID as well.
All right, it's 4 o'clock. We have some more questions. You want to keep going till 4:15? All right.
Sure.
Jonathan still has some confusion. He says it normally takes 10 to 15 years for a vaccine to be tested and approved for use. How can we be sure that vaccines are safe when they were brought to the market in less than a year?
Okay. All right. So this comes up a lot. Again, please check our FAQ site. With vaccines, they're not the same as medications, right? The medications we take routinely, we take them constantly, and there's a chronic exposure in our bodies. And so medications can, in fact, have long-term impacts on our system. Vaccines, you get once or twice, whatever the system, our immune system responds to it, and then the vaccine product is gone. There is no long-term impacts from vaccines, okay? All vaccine adverse events are generally identified within the first 60 days, and quite honestly, within 30 days. So those events have been closely monitored. We actually have like millions of vaccines now that we can look at. We have 4 different surveillance systems. And so the idea that there is side effects here that we've missed is becoming increasingly small. Okay, because we found a couple adverse events, right, that are really, really rare. The myocarditis, the thrombosis, thrombocytopenia thrombosis, J&J. These are really, really rare adverse events, and we still picked up on them. Okay, we still picked up on them because of this way we have the surveillance. So long-term side effects is kind of a misnomer, right? It just doesn't happen. Now, why did we get this vaccine in front of us in such a short period of time? Because the government poured in millions and millions of dollars. Normally, a pharmaceutical company has to invest in research and development on their own and has to go through all kinds of phases to make sure that the vaccine is going to be effective and reliable before they would take the next step to invest into the next phase of trial, phase 1, phase 2, phase 3. And we were facing a daunting situation where we knew as a nation and as a world that this vaccine was absolutely critical to get out. And so that process was sped along with lots of money and a lot of layering. So they took phase 1 and phase 2 and they put them together. And they speeded up the phase 3 trial. Not that there was any corners cut with number of people tested or the outcomes that they had to measure, and all that was the same, other than they didn't wait months between each trial and then a month before the experts met and reviewed the data. They cut off all the bureaucracy. And they cut, quite honestly, the risk to the pharmaceutical companies as well, the economic risk of producing a vaccine. Vaccines do not result in a lot of profit for pharmaceutical companies, which is why vaccines have been kind of put in a different category now with support from the government, because they're a population health benefit with not a lot of economic benefit to a pharmaceutical company. Think about a drug like Viagra and what a company will make per pill, people taking these medicines over and over again, where you have a vaccine that's generally advised to be given once, maybe twice in a person's lifetime, and sometimes only for very specific age groups and people. That is not an equation for like making tons of money. So a few issues there related. Maybe you didn't ask about the pharmaceutical benefit, but the fact that it was sped along is a good thing. It's benefited us to a great deal, and it was really done by cutting through the bureaucracy.
Yeah, it actually was one of the most successful public-private partnerships that we've ever seen in our lifetime.
Right.
Yeah.
All right. This is just to Kelly. She missed it when you explained about fully vaccinated students who are exposed. They don't have to quarantine. she can go back and watch that again because we covered that
Right,
already.
right.
Okay, next question. It's interesting that at least, this is from Sue. It's interesting that at least 50% is vaccinated and the surge is just as bad as last fall. How are the vaccines stopping this?
Oh, let's go back to our slide. It's very interesting because the surge is not as bad as it was last fall.
No, it's
Oh,
we got to go back to the
well,
first
but
slide.
still, I mean, we really have I'm amazed that we are not surging much higher than this with the Delta. I mean, you look at this curve and it's extremely blunted. And quite honestly, it's kind of hard right now where we're at. We've exceeded a level where we can effectively, monitor it and respond to it. And our hospitals are a little stressed out, but it's doable. If you look what was happening back in last winter, this was not doable. We doing that over and over again would be a really difficult thing. So I do believe that even with a 50% vaccine rate, it is blunting the transmission of this virus, as is the previous infections, allowing people to have some innate immunity from previously infected. I think that's what we're seeing. What we don't have is enough vaccination to stop the transmission. And in communicable diseases, if we know we have a certain level of immunity, you guys have all heard herd immunity. What'll happen at that point is you'll get a case or two, and then it just disappears. You won't see it. The disease doesn't go away, but it doesn't just keep spreading and spreading and spreading the way we're having right now. So that's really the difference here. My necklace is messed up. Okay, so I hope that answers your question.
Yeah, and a
Okay,
little bit to add on that too
go ahead,
is,
Justin.
they just announced, the CDC just announced yesterday or the day before that the MU variant, and I don't know, I'm not a Greek guy, I don't know how to say it, but that has been
You.
eradicated from the United States. The mu variant has been eradicated from the United States, and that is a testament to the vaccines and
Mhm.
other work that's being done. So we have been capable of getting rid of strains of this, but Delta is much more dangerous and prolific.
All right, the next question is from Nikki. Are you seeing a rise in flu this year? My son had the flu A last week.
Oh, oh. I haven't gotten my first report, so I hope he's doing well. This is the usually with the very beginning of what we start seeing flu. Flu tends to peak October or later, but we'll see cases scattered actually throughout the year. We'll see flu cases even in the summer, so it does crop up. But that real surge of flu, um, we're kind of looking and expecting it in October, November, and of course, it can continue to surge and have peaks all the way through March. And that's the seasonality of influenza. Whether it'll happen this year, as you know, last year, not a lot of it. We had some. We had over 1,000 reported cases in our county. It wasn't like we didn't have any, but normally we have like 7,000 reported cases, right? Am I getting those numbers about right? So that's really the issue. Will we see a blunted influenza season this year? We believe that last year the reason we saw a blunted response is because everybody was wearing a mask and everybody was like being super careful. When everybody was all like COVID freaked out, right? And remember when our COVID started to peak last year, it was right when we'd expect flu season, right? It was like November, December. We came down, didn't we? Came down for a little bit and then we went back up. So there was a lot of people sick with COVID, which obviously doesn't allow as much mingling together. People were just being careful, I think. So we'll see what happens this year.
Okay, some more confusion about quarantining, and this is more like a contact of a contact question. So from Lindsay says, ask why if one student quarantined but their siblings are not, if it can take up to 12 to 14 days for symptoms to show.
Well, you don't quarantine exposures of exposures. Okay. Otherwise, you would just end up everybody would be quarantined, right? I mean, there is a limit to this. You only quarantine the people who've been exposed to a case. So if you have say you have a classroom and there's one kid that comes to class and he's sick and he goes home and sure enough he's got COVID and the school looks at the situation. A lot of times our schools are using seating charts and they're saying, okay, 10 kids in that classroom sit close enough to that student to warrant that 6 feet, 15-minute. So all those kids are quarantined, right? Those kids go home. They're not sick yet. They're not infected. They have a higher risk of becoming infected, which is why we want to, again, keep them separated and kind of slow that transmission down. But until they are infected themselves, either by becoming sick or testing positive, their exposures aren't even counted. So their household is not impacted at that point. So it would only become an issue for the household if that child tested positive or became ill and tested positive. Okay. So contacts of contacts aren't quarantined. You should be careful. I would agree. I would have my radar up, but they don't have to actually go through that quarantine process.
Okay, this is from Cassandra. Do you differentiate between breakthrough cases after vaccination and after infection, or are they all lumped into the same category? If they're not, do you have the numbers for each?
Do we have breakthrough cases after previous infection? I'm going to give that to Brandon and see if that's something that we pull with the data. I think that information might be there if the individual actually has a case investigation. I'm sure that's part of the case investigation and it would be put in their system. Remember that we're only doing about actually getting a case investigation on what, 10%? Half, about 50% of individuals. So that's kind of a little bit of a crapshoot. What do you think? Reinfection after a natural infection. No. Okay. How about we get back to you about that? Because I don't know that they can hear you talking in on these long pauses. What Brandon's saying is we don't have a lot of really good local data on that, but there's probably some national data that's estimating this and kind of looking at it. From my understanding, it's still rare, which is why we're pretty confident that the post-infection piece is right up there with the post-vaccination piece. Bigger problem we have is proving a person had a previous infection and putting them into our system. They have to fit, they have to meet criteria, and we can't just take people's word for it. We have to meet criteria to actually put it into the system. But I would bet that's in the system if we've done a good case investigation. It's just a matter of whether or not we're officially pulling it. I have, off the top of my head, I have not seen that even on the state level, but it's probably there somewhere. 2 times the risk. So their risk is higher than a vaccinated individual, but still much lower than an unvaccinated individual. Is that right? Okay. We'll post that question a little bit more clearly after you have a chance to research it a little bit more.
Okay, it's 4:12. We have 2 more questions, and if we miss anybody
Go
else,
for
they
it.
can email us at covid19@stclaircounty.org for any further questions. This is from Dana. Any comment on the new CDC info on Barnstable County Mass, where 74% of 469 people are fully vaccinated individuals? Same thing is happening in Israel.
Follow up on that. Yeah. So I'm gonna defer that a little bit, and we'll answer that question more fully. But I can tell you that the Israel question, when you have a fully vaccinated community, you are going to see more vaccinated people get infected than unvaccinated people. It's just kind of a statistical thing. The Barnstable County is a really interesting area, and that is what brought the CDC to the attention of that we should be adding added precautions to fully vaccinated people if there's high risk exposure. Remember, although I believe I read some follow up that that was a very unique situation where they were together for a long period of time. It was a very closed in community. So I don't know if there's anything more illuminating on that. But again, the information on those two situations, I think people kind of try and take that out of context and say, see, vaccines don't work. And again, the remainder of what we know and what we see and the information we're collecting is still extremely reassuring that the vaccine is doing a good job protecting us.
Okay, and the last comment before we have to sign off is from Jenny. Has a booster been approved yet, and will you be able to mix manufacturers?
I just sent her the data,
Okay.
but we can answer.
Yeah.
Yeah.
Yeah, a booster, by the way, a booster dose is going to be the same dose as your primary series, at least so far with Pfizer. It has only been approved for Pfizer, and it's only been approved for people who've received their primary series with Pfizer. So at this point, we don't have any further information. So if you got Moderna or J&J, it is not currently recommended that you get a Pfizer booster. It's just for those who got their primary series with Pfizer within the last 6 months, and then you can get a booster of Pfizer at this point. There's more to come on that, though. There's some really interesting literature out there that would suggest that maybe we will be able to booster with other products if you've had another one, but we're not there yet, and we'll let you know as soon as that is determined.
Okay, and you can always send your questions to COVID-19 at stclaircounty.org. Okay, Doc and Justin, any closing comments before we close today?
One, it's great to be back here for a couple weeks. I appreciate the invite. And on the emergency management side, as always, we are providing support and any needs to the health department as well as the communities. And thanks for having me back.
Thanks, Justin.
Well, given the fact that we're fighting a battle here against a virus, which I will say again is our primary battle, our job as a health department is to combat communicable infectious diseases, and that's where our goal is, and that's why we follow. Everything we're doing is based on that. It's still, I'll just say this, it surprises me, and I'm going to try and turn to wonder and not any judgment. It surprises me that so many people are working so hard to undermine what we do and to increase their risk of getting an infection. Infections really aren't fun. I don't care if you have a 1% risk of survivability or a 99.9% risk of infections are bad. And infections running through an entire society are even worse. So let's not fight so hard for the privilege of getting infected, and maybe we can fight a little harder on taking care of each other and moving on with our life with this virus a little bit more under control.
See you next week.
See you
Thank
next
you.
week.